Hello, I'm Henry Finn, Medical Director of the Chicago Center for Orthopedics and Robotically Assisted Surgery. I'm also a professor of orthopedic surgery at the University of Chicago. I would like to give you a close-up look at the latest hip replacement technology. More than 500,000 Americans will undergo hip replacement surgery this year. The latest computer-navigated surgery gives them another option for improved outcomes. It's called RI.HIP, which stands for Real Intelligence Hip. There are a couple advantages to this new technology. RI.HIP allows for accurate positioning of the acetabular component, or the hip socket. It also helps with perfectly balancing the soft tissues of the hip, and it should be noted that malpositioned acetabular components can lead to dislocation or accelerated wear. This is why it is so important to offer the RI.HIP technology to our patients. It delivers precise positioning of the acetabular component. Another distinct advantage of this computer-navigated surgery is in obtaining equal leg lengths. Surgeons take cues from the computer screen after the technology registers the hip area. Surgeons no longer need X-ray imaging in the operating room, which decreases the time of surgery and the exposure to radiation. Leg length discrepancy is one of the greatest dissatisfiers for patients, but the RI.HIP can assist in accurately establishing equal leg lengths. I hope to see you soon to treat your hip pain.